Professor Chamila Mithananda, Professor in Pharmacology, University of Kelaniya, and Dr. Tiyahini Sunil Navaratini Raja, Senior Lecturer in Pharmacology, University of Jaffna.
Good afternoon. It's my pleasure to welcome you to the third and the last symposium of Clinpharm 2024. So the symposium is going to be on medication safety curriculum, which is a very important topic for all the academic pharmacologists. So without further ado, I would like to invite my co-chair, Dr. Tiyahini Sunil, to introduce our first speaker.
Good afternoon, ladies and gentlemen. So the first speaker is none other than Professor Priyadarshini Galapadi, and she doesn't need any introduction, so she is going to address us on WHO Medication Safety Curriculum Guide and Overview. It's over to you, Professor Galapadi.
Thank you very much, Tiyahini. So what I'm going to talk to you is on the WHO Medication Safety Curriculum Guide. This guide has been there now for a long period of time. So this is my the overview. I will talk about the WHO Medication Safety Curriculum Guides available because we have, as of now, 2 guides that has been issued, and the learning objectives and learning outcomes on medication safety, which is one of the topics of the Patient Safety Curriculum Guide. The contents included, and the teaching strategies and assessments, and few things about the updated WHO Medication Safety Curriculum Guide, which will be published hopefully within the next about 2 or 3 months, definitely before the end of the year. So WHO published this patient safety curriculum guides some time ago. The first, it was published as for medical schools, which was in 2009. And then they released the second version, which is the multi-professional edition, because considering patient safety cuts across not only medical professionals, but also particularly pharmacy and nursing, so targeting other categories of medical professionals, issued the multi-professional edition. And there are many topics included like surgical safety, diagnostic safety, and safety of injections, healthcare associated infections, and so on. And there is, and these both documents cover almost similar content, but the second version covers aspects in a way that it is relevant to other healthcare professionals as well. So medication safety is actually the last topic in this guide, topic 11. Not only that there is this curriculum guide, but there are accompanying slides as well, which people can use during teaching. And it gives many case scenarios where these can be used during teaching, because particularly patient safety and medication safety and again medication errors, a lot of things can be learned on the real cases or real life incidents, and therefore there's a lot of learning opportunity. And then it also gives suggested assessment methods with examples. So both these 2 documents you can freely download. I have given the web addresses, but if you just Google WHO Patient Safety Curriculum Guides, these 2 can be downloaded, and all the content will be available. So the learning objectives given in the curriculum guide includes, I have given the learning objectives for topic 11, which is on improving medication safety, to provide an overview of medication safety and to encourage students to continue to learn and practice ways to improve the safety of medication use. And so those are the learning, broad learning objectives given. And the learning outcomes are given in 2 components. One, knowledge requirements, and then the next one is performance requirements. So these are the some of the knowledge requirements given under medication safety. Recognize the scale of medication error, identify the steps involved in a patient using medication, the factors that contribute, learning how to make medication use safer, and recognize the healthcare professionals' responsibilities and roles when using a medication are the knowledge requirements listed. And these are the performance requirements that are included there. So using generic names, tailoring prescribing to each individual, practicing medication safety histories, the high-risk medicines, the look-alike, sound-alike medicines, using memory aids such as BNF or some formulary to check when they are in doubt, the 5 rights, communicating clearly, checking habits, and patient engagement, and then reporting and learning. So these are the, so all these aspects are things which they should have, should be able to perform as a healthcare professional, either doctor, nurse, or pharmacist. And it gives definitions of terms and explanations. What is a side effect? What is adverse drug reaction? What is an adverse event? Because there are many, some references give different explanations, but what is mostly accepted and mostly used, definitions and terms and explanations are given. And the key important thing highlighted is that these errors are preventable. Adverse events are, these medication errors are preventable events. It is usually as a result of an error, whereas what is not preventable are the adverse drug reactions. So an adverse drug reaction, for example, if you do not know, if you did not have a previous allergic history, you will not be able to prevent an anaphylactic reaction which can occur because patient would have got sensitized early and could get a reaction. And then what the medication error can result in, if the patient can be harmed, or it can be near miss, or it can be neither harm nor potential for harm, just a minor error. The curriculum guide gives the stages where the errors occur. I won't go into detail, starting from prescribing right up to monitoring treatment. And then what prescribing involves, that is rational use, selecting the route, dose, time and regime, communicating, and documenting. Again, documenting is very important, which is essentially prescription writing. So this information is given in the curriculum guide. On prescribing, how can prescribing go wrong? Because that is when we talk of errors. So the inadequate knowledge, incorrect calculations, use of abbreviations, and then look-alike, sound-alike medicines, ambiguous nomenclature. These are all given in the curriculum guide. Administration, again, what it involves, how can drug administration go wrong, are given. So I'm just telling you because if you're now, we have actually introduced, we have done a survey among all medical faculties and asked them what are the components that are included into the curricula. We did that in 2021. And then I think almost all medical faculties started introducing these components at whatever possible times. But we are now trying to implement these into the pharmacy and nursing curricula. So therefore, these are some of the things that we question them. And when you are using, you can use this curriculum guide in introducing content into the curricula. So again, monitoring, what it involves, how can monitoring go wrong, and which drugs need blood test to monitor, like warfarin, lithium, and so on, given. Again, another thing that is highlighted is knowing the medicines that are commonly prescribed is given, and common medicines that is prescribed is something that they promote. developing a personal formulary. Now in Colombo faculty, we actually do for the third year medical students when they start clinical appointments, we have pharmacology ward classes, and there we introduce many of these things, and we give them a workbook where they are expected to write down some of these things, and also we request them to develop a their personal formulary of the most common medicines that they see being prescribed, because those are the ones that they are going to use during their undergraduate, when they become interns. So we request them to develop a personal formulary. We also developed a student formulary in the Colombo faculty. So I'm happy to say that there is a lot of demand for that. Many of our students, not only in our faculty, but many other faculties and pharmacy graduates use this, and we are told that they find it quite useful, because BNF has now become very it includes so many new medicines, and then it is not confining to only the most commonly prescribed medicine. Sometimes it is difficult to find medicine also in the huge BNF. So many students are therefore using student formulary as well. Using memory aids, again, the textbooks formularies is highlighted. These are the 5 rights. So again, teaching all 3 categories of healthcare professionals to remember to check the 5 rights at prescribing, dispensing, and administering. It's highlighted. Developing checking habits, particularly if you are in doubt, you need to check whether what you have prescribed or what you are going to dispense is the correct one. And many examples with stories are given. And encouraging patients to, this is for patient engagement, when particularly a new medicine is introduced into the patient's treatment regime, to encourage the patient to ask questions and give as much information as possible. I think calculation errors, this is one of the items in the prescribing skills assessment or prescribing safety assessment in the UK. You give a scenario and ask the patients students to calculate the amount of drug that has to be given, like you have given here 12 kg 2-year-old boy requires a medicine that comes as a syrup with the concentration, and how many milliliters should you prescribe, and so on. And then there are case scenarios of errors, like in this situation where I won't go into details, but where adrenaline, which has been drawn into a syringe to be kept in case to be given, another doctor has given thinking it is a flush solution. So, and then so these examples give good idea of what can happen in a busy clinical setting. And then so this is what happened to the patient, and why this happened are given. So there are questions for discussion, like identifying contributory factors, and so that those can be addressed in prevention. And then, so these are in the guide, these scenarios are given, and then some questions for discussion. How could this error be prevented? You can download this and then go through it if you are not familiar with it. These are the various teaching strategies that are suggested in a medication safety curriculum. And then some of the assessment methodologies, like MCQs, calculation quizzes, OSCE stations, and so on. And I will now, in the just remaining a few minutes, I will talk a little bit about the updated curriculum guide. So that this guide is now being developed, almost finalized. It's a standalone document, not a component of the overall patient safety curriculum guide. It's designed to support and assist development of competencies in medication safety. So again, aspects to be taught to all categories of healthcare professionals are included. Continuous learning and practice in medication safety is encouraged. And again, interprofessional learning as much as possible, that is all doctors, nurses, pharmacists, all learning together is promoted. Contains two parts. Part A gives guidance on how to implement the curriculum guide, while Part B provides teaching materials, the foundational concepts and principles of medication safety, and the priority areas and different implementation approaches. So this is what is included in Part A. There is a glossary again giving all definitions, which are given much more than what is given in the previous curriculum guide, and a guide to how to review the existing curricula and how to integrate the medication safety teaching into the existing curricula, whom to involve, the process to follow, questions to ask, and so on is given. The core principles, safety, teaching and learning, aims and learning outcomes, and it is a competency-based education is promoted, where the core competencies, advanced competencies, and specialist competencies are identified. And again, what to teach, assessment methods, and evaluation of the curriculum are also there. So part B, in the curriculum, again there's an introduction to competency-based levels. The various levels are given in the chapters. Again, learning objectives, outcomes, again knowledge-based ones, and the behavior and performance-based ones. And this guide actually is centered around the global patient safety, global burden. There is global burden of medication-related harm, is given, which is given as an advanced competency, and then the WHO Global Patient Safety Challenge on medication without harm. The interventions that can be done are categorized under the 4 domains of the challenge, and detailed case scenarios are given. So other chapters in part B are the steps in the management of medicines and medication use process, contributing factors and with examples, the priority areas of the WHO challenge, polypharmacy, high-risk situations and transitions of care, and linking medication safe to broader context and other initiatives. So I think this is my last slide. So the updated guide will be published soon, definitely within this year. And similar to the previous guide, it will also have the accompanying slides as well. So the subsequent presenters will give actually, we did a survey using the components that are there in the updated guide, and they will present how they are going to introduce those into curricula. Thank you.
Thank you, Patti, for that very comprehensive overview of the curriculum. So before moving on to the next talk, we have received a ladies' wristwatch. If any of you have lost, right? Okay, right. Thank you. Right. So moving on to this the second talk. The second talk is on implementation in medical curricula, delivered by Professor Pradeepa Jayawardena, MBBS, PhD, FRCP. She is Professor in Pharmacology, Faculty of Medical Sciences, University of Sri Jayawardenepura, and she is the chairperson of the Specialty Board in Clinical Pharmacology at the Postgraduate Institute of Medicine, and also the co-chairperson of the Research Council of the University of Sri Jayawardenepura. Over to you, Professor Jayawardena.
Very good afternoon to you. Thank you very much, the chairperson, madam, for your kind words of introduction. Within the next maybe 10-15 minutes, I will be sharing our experience on a survey that we did to check the implementation of medication safety curriculum in the medical faculties. You know, we have been talking about medication safety, medication errors and medication safety over the yesterday and today. And Professor Galapathy gave a very good idea about the medication safety curriculum guide. And as an initiative to enhance the education and to reduce the risks related to medication use, WHO has provided a medication safety curriculum guide. And actually, initially in 2021, we conducted the medication safety curriculum, WHO medication safety curriculum was actually, we started to implement it under the guidance of Professor Priyadashini Galappatti. And we actually presented some of the data that at that time, what was the state of medication safety that is addressed in our medical school curricula in one of IUFA Safe Medication Day. And now in 2024, we again did a survey to see, to map the components of WHO medication safety curriculum with the existing medical curricula in Sri Lanka, using a questionnaire which was developed by Professor Galappatti and with the contribution of several other educationists to check what is the how medication safety curriculum is implemented. So in this questionnaire, initially we collected details of the medical schools and the existing curricula. And then there were 3 components where knowledge requirement covered in the curriculum. We checked the knowledge requirement, the performance requirement, and plan for implementation, as Professor Galappatti described in her presentation. So we do have 12 medical schools in Sri Lanka. 11 medical schools participated in this study. And pharmacology is taught as a separate subject in in 10 medical schools in Sri Lanka, and it is tested as a separate, assessed as a separate subject in 7 medical schools. And medication safety is mainly taught at within the pharmacology curriculum. But apart from that, it is also taught at therapeutic ward rounds, integrated ward classes, clinical attachments, and also in clinical clerkships. And according to the data we gathered, average about 13.3 hours, PO hours are dedicated to teach medication safety. So first we gathered data on knowledge requirements. What knowledge requirement was discussed by Professor Galappatti. What we did was, degree to which different aspects are addressed in the curriculum was assessed using a scale of 5, where 1 was least addressed, 5 was well addressed, and if it was 3, if a particular medical faculty selected that item as in the scale of 5, 3, we considered it to be satisfactorily addressed, and then we calculated the percentage of medical schools address the different components satisfactorily. And those data are presented here. I don't think I have time to go into each and every component that was listed, but I will highlight some of the important areas. Now, if you take all 11 faculties, 100% satisfactorily address the definitions, explanations of medication safety related terms, and then polypharmacy and medication safety challenges and the value of deprescribing that we talked in the morning, and then the interventions regarding medicines to reduce errors, and interventions that we do targeting the healthcare professionals, and also obviously methods of preventing antimicrobial resistance. 100% of the people addressed it because it's a problem in Sri Lanka. And also essential medicines list and knowledge on medicines in the list, there was 100% addressed satisfactorily. However, most of the components that we checked on 21 components, and most of the components have been very well addressed. But there are some areas I thought we would want to draw a little bit more attention. like medication safety in transitions of care and medication reconciliation to address errors, what Prof. Chamila discussed in the morning. And that was an area that I think we need to address a little bit more. And then systems and environmental factors contributing to high-risk situations and ways to make medication use safer. Again, an area that we would like to, a little bit more weight has to be put in, and interventions for systems and practices. But of course, these are not well addressed, but these are, these are the things that are least addressed and the areas which require attention. And then we looked at the performance requirements. Professor Galappathy, in her introductory lecture, talked about the performance requirements, and we checked degree to which different aspects are addressed in the curriculum using a scale, again the same scale of 5, where 1 was least addressed and 5 was well addressed. And as in the case of knowledge requirements, if it was 3 or more, it was considered to be satisfactorily addressed, and percentage of medical schools address the different components satisfactorily was calculated, and I have given the data in the next slide. And these are the, we checked about 20 items, and use of generic names is very well addressed, 100%. And prescribe the high-risk medication, taking precautions when prescribing high-risk medications, very well assessed. And encourage patients to be actively involved in the medication use process. Okay, that is also well addressed. And advise patients on how to take medicines is also well addressed. But most of the areas are over 90% satisfactorily addressed by most of the medical schools. Then if you look at the performance requirements, these are the areas which require more attention. Medication reconciliation at transitions of care, as we discussed in the morning, and identification of risks at each stage of medicines use process that are relevant to their own areas of practice, and address such practices by adopting strategies to prevent patient harm is an area that was not well addressed. Then we looked at the plans for implementation of WHO medication safety criteria curriculum. Actually, it is being implemented, but in the very soon we will get another updated document on medication safety curricula, and that will have to be, it will be good if we implement that too in the medical curricula. So we looked at, okay, how, what are the plans for implementation? And mapping exercise, now usually mapping exercise has to be done to identify medication safety content in the existing curricula. I would say it was not very well addressed, only about, it is a component that I think it is essential to do. So about only 19% excellently addressed it. And then we looked at the plans for medication safety teaching to be integrated into existing curricula. We checked it at different levels. We asked what are your plans to get involved the professionals in implementation. Most of the medical faculties stated that they will involve a multidisciplinary team, especially involving the pharmacologists and clinicians. And we gave options for integrating medication safety into existing curricula. They gave 5 options, linking medication safety with existing pharmacology curricula, and then linking it with specific clinical subjects, and also introducing standalone curricula. And most of the faculties, like the most popular mode of integrating was to integrate into pharmacology curricula, obviously. And then we also checked what are the what are the technical skills that curriculum would address. We provided about 7 technical skills, and all technical skills would be, they stated that they accepted that this would be addressed well. And non-technical skills, there are about 4, like teamwork and communication, strategies for seeking information respectfully from colleagues. Those are non-technical skills that are needed in maintaining medication safety, communication with patients and all, and those also very good response rate was found. Over 82% response rate was found, satisfactory response rate was found. And then we checked what are the methodologies that we will be using, you will be using. We gave the options of interactive lectures, case-based learning, practical workshops, project work, guided reflections, group discussions, case or incident analysis, e-learning, role-playing, but of those, interactive lectures, case-based learning, and e-learning and role-playing exercises were the most popular popular methodologies that they said that they are ready to adopt. And assessment, where when we introduce something new, we definitely will have to assess because we know our students are very exam-oriented people. Assessment is very good, very important. Many people said they will do formative assessment. 82% agreed with summative assessments. And when we asked about the modes of questions, essay, multiple choice, short answer, extended written work, OSCE and OSPE portfolios, out of those, many said that they will assess with multiple choice questions and OSCE and OSPE. None agreed with extended written work. And then assessment at the workplace, how well these medication safety practices are applied. Maybe it may not be very relevant to undergraduate students, but when we checked it, direct observation, 360 feedback, which is a good way of assessing, is not a very good, a popular one. Self-assessments are the ones which was selected by many, 63.64. Then when we implement something, we have to monitor whether implementation has occurred well. Then we checked what are the ways in which they would like to monitor implementation, self-reflections, questionnaires, focus groups, individual interviews, documentations, records, but most of the medical faculties, 72.73, selected self-reflections. And in conclusion of the plans for implementation, extent to which a mapping exercise done, maybe we can put a little bit more effort on that and improve that. And I should say that we actually started implementing medication safety curricula in 2021, and this is in 2024 survey, so you would have seen that most of the components that we checked on, the knowledge requirements and the performance requirements, most of them are very well addressed, but there are a few things that we need to sort of focus on, and that should be the way forward. And I think I should thank, before this comes to the, I come to the end of my presentation, and I take a minute to thank Professor Galappatti for her leadership in doing the questionnaire and planning everything, and also Professor Nitushi Samranayaka and Professor Tamara Amarasekara for helping in this survey, and because we did this survey on pharmacy and nursing schools as well. And thank you very much.
Thank you so much, Pradeepa, for summarizing the current status, and you congratulate your team for carrying out and providing the background information and the gaps identified, and hope SLSCPT will take forward in future. Now we will move on to the other speaker, Dr. Utpali Manaperuma. She is going to talk on implementation of medication safety in pharmacy curriculum. Dr. Utpali Manaperuma, a senior lecturer in pharmacy at the Department of Pharmacology, Faculty of Medicine, University of Colombo, also serves as a council member of the Ceylon Medical College Council. Dr. Manaperuma began her tenure at Department of Pharmacology as a temporary lecturer in 2006, progressing to lecturer in 2007. In 2009, she was awarded the Thailand International Cooperation Agency scholarship to pursue a Master's in Science program in pharmacy in Mahidol University, Thailand. She completed her PhD at the University of Colombo in 2018. She dedicated to advancing pharmacy and nurturing future professionals. She actively engages in teaching and research across multiple state universities in Sri Lanka. Her research interests span pharmaceutical science and pharmacy practice. It's over to you.
Thank you, Madam, for those kind words of introduction. I would like to thank the organizers of Clinpharm 2024 for providing me the opportunity to present today, and especially Professor Priyadashini Galapathy and Professor Pradeepa Jayawardena for giving me this chance to present on the medication safety curriculum implementation in pharmacy curricula. Before I give the results of the survey, I want to give a background on pharmacy education in Sri Lanka. So pharmacy education in Sri Lanka dates back to the last century, and the certificate holders of efficiency in pharmacy and proficiency in pharmacy offered by the Ceylon Medical College Council served and continue to serve as community and hospital pharmacists after they follow a 2-year training. In 2001, the first graduate level pharmacy education commenced in Sri Lanka, which was the BSc Pharmacy Honours degree offered by the University of Colombo, which was initiated as a collaboration between the Department of Pharmacology and Chemistry of my university. So I stand here proud as a product of this course. There's me plus 5 of my colleagues who are representing now 3 universities, professors, senior lecturers, who are from the 2nd to the 4th batch of BSc Pharmacy. Apart from the BSc Pharmacy course, 6 state universities offer the B.Pharm degree programs: the University of Sri Jayawardenepura, Peradeniya, Jaffna, Ruhuna, the Open University, and the Sir John Kotalawala Defence University. So we did the survey to map the components of the WHO medication safety curriculum with the existing undergraduate pharmacy curricula using the same questionnaire, which covered the same domains. So the results are as follows. So 7 departments of pharmacy of the universities responded to the survey, and pharmacology is taught as a separate subject in all and assessed as a separate subject also. The medication safety related aspects are taught for more than 2 years in many curricula. And where are they taught? Apart from pharmacology, it's taught mainly in the pharmacy practice, clinical pharmacy, community pharmacy components, which the different universities have their different nomenclatures, which I present here in the results. And then the teaching is mainly lectures, tutorials, and case-based discussions in all universities. But and many do ward-based discussions as well. Some do small group discussions and problem-based learning. The components are assessed as MCQs, SCQs, and OSCEs. Some universities do practice clinical-based assessment as well. So we asked the number of hours dedicated to medication safety. at present. So the numbers ranged. I think this is due to calculation of the exact number of hours that are dedicated for medication safety, and it spans and the hours spanning the different curricular components that encompass medication safety practices being taught, like in practical sessions or in clinical training and pharmacy practice training. So next are the results of the survey. So we use the same scale, a scale of 1 to 5, where 5 denotes well addressed components in the curriculum related to knowledge, and a score of 3 was considered satisfactory, addressing the component. So here are the results. So I have highlighted the areas where the components the respondents felt were not highly addressed. So there were a few 3s rather than a resounding or unanimous 5 from all universities. But yes, they are being covered at present also. So for the knowledge requirements, the areas to be highlighted is that similar to the medical curricula regarding the medication safety in transition of care at reconciliation, and regarding the systems for environmental and other factors that lead to high-risk situations and the interventions, whether they are adequately or highly covered in the curricula. Next, the performance requirements are summarized with the same scale, and here are the results. So again, some they are covered, but even when it's satisfactorily addressed, these highlighted areas didn't have 100% well-addressed response from all of the responding universities. So, yeah, regarding performance requirements, I feel there is a need to see how well the performance requirements are addressed in the current curricula, and think about making students familiar with medicines, risks, and strategies to minimize risks, because that's where we felt that they are not 100% satisfactorily addressed, and the student performance on identification of risks. Then we checked what are the plans for implementation of the safety curriculum. So how well the mapping is done to identify medication safety content in the existing curricula. 2 universities responded, it is excellent. And so if one is planning to implement, I think the universities want to get all the professionals involved, and mainly clinical pharmacologists and pharmacists at various capacities, like clinical pharmacists, local and international as well. These are the options that were given for integrating medication safety into the existing curricula. So linking and integrating the curriculum to the existing pharmacology curriculum was everyone wanted, had the highest option rate, whereas introducing a standalone curriculum, I think, was not thought as being possible at present. So if the plans for the WHO medication safety curricula is to be implemented, these were the responses. So the technical skills that the curriculum would address. So we can see that, yes, administration, calculations, documentation, then eliciting history and information resources, those would be would be addressed, but there were 2 non-respondents for the domain of prescribing, because I think in Sri Lanka, pharmacists by law cannot prescribe, but many, like more than half of the respondents felt that the prescribing, knowing about prescribing is also important. All the non-technical skills, all universities felt are vital for pharmacy curricula, like teamwork, strategies for seeking information respectfully from colleagues, communication with patients, and generic communication skills. Then, so if the curriculum is to be implemented, these would be the teaching learning methodologies that we would like to utilize. So all of the different methods that were given were thought to be useful by many. The assessment methods. So all universities are planning to have summative assessments, and which will be assessed mainly by OSCEs, OSPEs, followed by portfolios. And then the lowest response rate came for extended written work. The assessment methods that will be introduced, all universities responded saying reports and oral presentations will be used, followed by direct observation, self-assessment, and last 360-degree feedback. How the curriculum will be monitored, the plans would be mainly with self-reflection, followed by documentation, questionnaires, and observations. Focus groups and individual interviews had the lowest response rate. So finally, I would like to give a few concluding remarks regarding the responses that we received, and I want to mention that with the responses, we see that the extent to which the mapping exercise is done and for identification of medication safety content in the existing curricula is very important, and it is important for program improvement. My message to the pharmacy academics, my colleagues in the audience, is to go back, we can check our curricula and see how we can improve our curricula as well. So 360-degree feedback was not opted by many, and there were direct and indirect remarks in the survey questionnaire, in the responses, that there is a lack of resources and lack of access to multidisciplinary teams in our setting. That may have been also a reason why this 360-degree feedback was not opted by many. The internal and external pharmacy courses were not directly included in the survey, although because there is discussions about improving these courses to meet the global needs at present, and we can't disregard the portfolio component that was there for the internal pharmacy training, which focuses mainly on medication safety and aspects, and it encourages reflective practice and has led to a lot of changes done at government hospital settings when the students went for their internship. And there is a dire need for continuous professional development and enhancing the skills of the existing pharmacy workforce in Sri Lanka as well. So I conclude my presentation. Thank you for your kind attention.
Thank you, Dr. Manaperuma, for that giving insight into implementation of medication safety curriculum in the pharmacy curriculum. Next, we are going to move to implementation in nursing curricula. Our speaker today is Professor Tamara Amarasekara. She's a professor and a distinguished scholar in the field of nursing with over 18 years of experience. She holds a PhD from the Faculty of Nursing, Chiang Mai University, Thailand, and has been a faculty member of the University of Sri Jayawardenepura since 2006. Dr. Amarasekara's research focuses on qualitative research, nursing practice, and education research. She has published over 30 peer-reviewed articles. Over to you, Dr. Amarasekara.
Good afternoon to you all. Thank you very much for your nice introduction. And first of all, I would like to say thank you very much for Professor Priyadarshini Galappathy, President, SLA CPT, and the committee of giving this opportunity for me. And also, I would like to say thank you very much for Pradeepa Madam, always push me, always guide me, and always help me to do this study. So this is, it is an honor for me to speak on behalf of nursing education in Sri Lanka. So this is how I'm planning to talk to you. The introduction, aim, methodology, results, and conclusion. In terms of introduction, we all know that medical errors is a leading cause of patient harm. We discussed this, and we already know this is a global concern. And from yesterday and today, we discussed many aspects of patient safety, and in terms of how to prevent medication errors and all. And patient safety is crucial in healthcare, and medication errors must be minimized, and everyone has a role to play in medication safety. So as a healthcare team member, nurses also has a crucial role to play in preventing medication errors. And as a nurse educator, I think it's high time to talk what are the inputs in medication safety, inputs in the nursing curricula, and how we can improve with the medication safety curriculum guidance provided by the WHO. As most of you know, the nursing education, how pre-registration nursing education happened in the country, but I just would like to show some brief introduction. We produce nurses for the government sector in two ways. One is the 3-year diploma in nursing program run by the nursing training schools or schools of nursing under the Ministry of Health, and it's a 3 years diploma program. And also we started in 2005, we started 4-year BSc nursing degree at universities, which is under the Ministry of Higher Education. And I am from the University of Sri Jayawardenepura, and I'm proud to say University of Sri Jayawardenepura started BSc nursing degree program for the first time in Sri Lanka. And both degree holders and diploma holders, once they pass out from 3 years or 4 years, they can get the Sri Lanka Nursing Council registration, and after that they can start to work as a nurse in the government sector or a private sector. This is how we provide, how we produce nurses in the government sector. So with that, with that in mind, we plan to evaluate, we plan to see how medication safety inputs in the nursing curriculum. And as Madam Galappathy and Madam Pradeepa mentioned, we did a small descriptive survey with the objectives to map the components of WHO medication safety curriculum components with the existing nursing curricula in Sri Lanka, and also to assess the feasibility of incorporating components of the WHO medication safety curriculum into local curricula. So you can see the two specific objectives of this study. And moving to the methodology, we use descriptive cross-sectional design, and the population And the setting is existing medication safety curricula of nursing schools and faculties. And schools of nursing, we have 16 nursing training schools under the Ministry of Health, and we have currently we have 7 BSc nursing degree programs in 7 universities. And recently, I think 2 years back, we got a faculty of nursing at the University of Colombo. So we use researcher developed questionnaire covering all aspect of all aspect addressed at the WHO medication safety curriculum, which was mentioned by Professor P. Darshani in her overview. And this questionnaire was pre-tested, and also this questionnaire sent to all heads of the departments in nursing and also the principals in 16 nursing training schools. And we use descriptive statistics, and we obtain ethical approval from Research Ethics Committee, Faculty of Medical Sciences, University of Sri Jagannathapura. So I plan to show you the results in 2 columns, like what I get from the diploma in nursing, that is nursing training schools, and from the degree levels. And first, I just want to say in diploma, 16 nursing schools run diploma in nursing, and almost all nursing training schools have similar curriculum, and the nursing universities have some minor changes, minor variations in their curriculum. However, most of the programs in the diploma program and the nursing program, they mention pharmacology is taught as a separate subject. And nursing diploma program mentioned that pharmacology assessed as a separate subject as well. And most of the universities also mention that they also assess pharmacology as a separate subject. So the duration, most of the diploma programs mention that they use 2 or less than 2 years to teach pharmacology subject. And the BSc nursing program, most of the universities mention that they use 2 to 3 years to teach medication safety related theoretical and practical contents. And in this slide, you can see apart from pharmacology subject, diploma in nursing course mainly use fundamentals of nursing subject to teach medication safety information. And also in universities curriculum, we use fundamentals of nursing, and we have number of nursing subjects called surgical nursing, medical nursing, pediatric nursing, maternity nursing, psychiatric nursing. In all these subjects, we teach some aspect relevant to the subject. We teach medication safety information. And in this slide, you can see most of the diploma courses, they use lectures, tutorials, and word-based teaching to teach as teaching methodologies. And the universities also use lectures, tutorials, word-based teaching, and also small group discussions and problem-based learning to teach this subject. And assessment methodologies, MCQs, SCQs, and clinical exams also use related to this subject in diploma programs. And university programs also, they use MCQs, mainly MCQs, SCQs, OSCEs, and also clinical practical exams to assess the knowledge and practice related to pharmacology. So I think the table is not very good to read, but you can see from the nursing training schools programs, knowledge requirements covered in the curriculum, as previously mentioned in the medical curricula and the pharmacology curricula. Majority mentioned the most of the knowledge requirements in the medication safety addressed in their curriculum. However, as mentioned in the pharmacology medicine curriculum, majority said it is not much covered in the curriculum, which is the polypharmacy and medication safety challenges and value of prescribing, and also reconciliation in medicine, in pharmacology. And for the rest of the questions related to knowledge requirements also, most of the knowledge requirements in the medication safety address in the curriculum. And the BSc degree programs also mention that most of the knowledge requirements address in their curriculum. And the performance, when it comes to performance, most of the diploma nursing program curriculum, they respond like the existing curriculum, safety, satisfactory address. I hope you can remember how we give the satisfactory mark in our 5-point Likert scale, address these performances. And diploma, yes, degree programs also, the existing, they said the existing curricula satisfactorily address these performances requirement. And the performance requirements, sorry, the previous one is related to the performance requirement in the BSc program. And this slide also you can see most of the BSc degree programs also mention that existing curriculum satisfactorily address these performance requirements. So I have included the non-technical skills here, but for the technical skills, as mentioned in the previous two presentations, most of them agreed to the all technical skills addressed in their curriculum. And non-technical skills, diploma programs and the degree programs both mention teamwork and communication, strategies for seeking information respectfully from colleagues, communication with patients, their families and caregivers, and generic communication skills, influencing and establishing rapport with others are highly mentioned non-technical skills. And yes, this is from the degree programs. They also mention these things. So in summary, we can say both diploma in nursing program and nursing degree programs mentioned that they are planning to implement the medication safety curriculum, and positive responses we obtain regarding the ability to incorporate medication safety curriculum to the existing diploma in nursing and nursing degree programs. And I have some more slides to show you the plan, how integrating medication safety teaching into the existing curriculum. Most of them mention diploma program and the degree program. They mentioned that they would like to have an interprofessional teaching for this. And here they also mentioned they would like to have interprofessional or multi-professional teaching for when we are upgrading the curriculum. And how to incorporate new materials. They said that lectures and small group discussions, problem-based learning, and also small group discussions would be good to incorporate into as new materials into the existing content. Both degree programs and the diploma programs mention that. And what are the assessment methods? In the diploma program, they mentioned the formative and summative assessment are needed. And written assessment, they mentioned mostly they prefer to have MCQs and short answers questions, and also structured questions. Degree program, they mentioned, diploma program in terms of workplace performances. They mainly mentioned that direct observations and oral presentations are very important, but you can see the how they mentioned about the 50% of they mentioned about 360-degree feedback is needed, and self-assessment also mentioned as a assessment method. And the degree programs, with regard to the assessment methods planned to introduce, they also mentioned formative and summative assessment are needed. In terms of written assessment, they mentioned, mentioned by the previous sessions, multiple choice questions and also short answers, and practical exams are needed in terms of assessment methods. And the workplace performances, they also nursing degree programs also mentioned that direct observation is highly needed. You can see 100% all universities mention that direct observation is very important. In addition to that, oral presentations and self-assessment also mentioned as important aspect in workplace performance. And what are the evaluation plans? We asked that questions. They mentioned diploma in nursing programs mentioned that questionnaires, focus group discussions, individual interviews, documents are their plans to how to monitor the implementation of the medication safety curriculum. And the degree program also mentioned that self-reflection, questionnaires, focus group discussions, and documents they would like to use to monitor the implementation of the medication safety curriculum. So moving to the conclusion, based on this study, we can conclude that integrating the WHO medication safety curriculum components into existing nursing curriculum in Sri Lanka is feasible and necessary to enhance patient safety. And these are my references. And again, I would like to say thank you very much for Madam Galapathy, who is initiating this and also continuously supporting and giving feedback. And you know, sometimes I made calls in late night to her, so she always said, Tamara, we can do this like this and do like this. So I highly thank Madam Galapathy and Madam Pradeepa for supporting with me. Professor Nitushi also support us a lot. So thank you very much.
Thank you, Professor Amarasekara, for the very informative presentation. Hope we all work together to improve the patient safety. So we will move on to the next speaker, Dr. Tilanka Senivaratna. She is a consultant pediatrician and specialist in allergy. She is the head of the Department of Pharmacology, Faculty of Medicine, University of Pennsylvania. She is keenly utilizing simulation in medical education. She has published and presented widely in simulation, medical education, artificial intelligence in medical education, clinical pharmacology, and allergy and immunology in national and international forums as the first author, and has presented award-winning papers. As the founder, vice president of the Sri Lanka Association for Simulation in Healthcare, she organized the first ever international conference on simulation in Sri Lanka. She is a founder committee member of the Asia Pacific Biomedical Science Educators Association and consistently contributing to the Asia Pacific Medical Education Conference as a resource person and an invited speaker. Dr. Tilanka is going to talk about simulation for teaching medication safety components. It's over to you.
Thank you, Chairperson, for your kind words of introduction. So, good afternoon, dear ladies and gentlemen. So far we heard how we have enriched our curriculum with medication safety components. And we saw in all these things, there's unmet need for performance component. Okay, so we will see now how we can drive these important concepts of medication safety to our undergraduate students, heads of our students, and the healthcare staff. So the simulation, the newer tool to teach medication safety. So, you know, these are the kind of paper cuts I got during the recent past. You see now 2023 July. So a 7-year-old reported dead after paracetamol overdose at hospital. 21-year-old girl dies at Peradini Hospital due to injection. And then a 2.5-year-old child died from anesthetic. Deaths at government hospital, inquiry report in 3 weeks. So these are the things we hear these days, and despite our teaching and every effort in reducing medication errors. So the question at hand is, We have been teaching medication safety all throughout, yet the errors continue to happen in a scandalous manner. So should we revisit the way we teach medication errors and how to avoid it? So when the medication errors occur, so think about the knowledge base. So we are giving all the knowledge. So think about the time and the effort we put to give the knowledge. But how to put the knowledge into practice? So I think there's some disagreement in the weight we put on that aspect. So should we emphasize the practical aspect of pharmacology more? So how can we give third-year mates the practical exposure? Are we going to take them to the wards? So which is not that practical, I suppose, given the number of students, and we have already fourth year and final year students in the wards. So how can we overcrowd our students also with those things, and also with the staff in constraints? So everything is not possible. So, but then, if you want to give the practical exposure for undergraduate students, that has to be in the context, their own context. Their own context is hospital-based, and the patients. So our pioneer work on this line is simulation, which came handy on this aspect. So where you are going to simulate this clinically relevant context environment for the students who are unable to be taken up to the wards. So we started with simulation with actors. Now why actors? Again, we train staff to make the scenarios and the environment realistic as possible. Unless it is so realistic and possible, students will not take it as something very close to their experience. So that is why we need the simulation to be more practical and realistic. So actors were trained in the scenarios which has already occurred, the real scenarios which has occurred in the recent past. So they were acting in front of the students, and students were commenting on the scenarios, and they learned the errors, and they were commenting on how they can avoid it and what kind of things they could have done. So like that kind of a very practical and as well as a broad-based learning. Now, secondly, and with this type of teaching going on, we got the COVID-19 pandemic. So now how are we going to take the student as for the face-to-face teaching, which is again impractical, and everything, all the teaching went on the online platforms. So our simulation also we shifted to the virtual platform. Luckily, we had recorded sessions as well as the newer ones we recorded, and we shifted that to the online platform, and we gave all these simulation experience to the students via online platform. And so then there was a question whether they would get the equal exposure, whether they will understand. Yes, they had a kind of a very good understanding as well as experience, because they didn't have much of clinical experience as well during the COVID-19 period. And of course, we did a crossover study among the undergraduates to see the impact of knowledge gain about medication errors with this type of online teaching. And this is the study we did, virtual simulation, and we got that the knowledge gain they get from this simulation-based teaching compared to lecture-based teaching is significantly high. So you can see in this graph even, the scores were about 20%. So the highly significant results with the P equals 0.002. So the conclusion was that the virtual simulation imparts significantly higher knowledge gain versus standard lecturing. And this shows an important direction in online medical education. So we presented that in Asia Pacific Medical Education Conference in 2022. So thirdly, now we know, so how about emergencies? So how do we teach emergencies? So we teach emergencies with this type of hefty algorithm, compact algorithm, so a student should be able to understand and learn, right? Now, emergencies is one of the main instances where people face medication errors. But that just happened with that short time period. So how are we going to give that experience to the medical students? Then we use these high-fidelity mannequins. So high-fidelity mannequins with carefully crafted scenarios so that students get immersive experience with emergency management and see how errors can occur, so on what occasions this can occur and how they can avoid it and what are the measures they can do to avoid it. So all these things which we gave with the high fidelity mannequin. Now the advantage of high fidelity mannequins is that you can manipulate the scenario and you can show the adverse effects which can occur with erroneous actions without patient harm. So, and this ended up with debriefing and collaborative discussion. So all these things were highly appreciated by the students, and they gave very good feedback with this teaching methods. So this one also is one of the publications we had. So, so how do these simulated error experiences impact attitudes related to error prevention? So this is one of the papers in the literature, so the published literature. So the conclusions were, stimulated error experiences made participants more aware of how easily errors can occur, and also they were more aware of devastating consequences of errors, and interventions resulted in long-term impacts on perceived caution in medication administration. So see the impact. So with this information, so our march beyond the available literature, so we thought we had to go more beyond it and think more beyond the available things. So, so we wanted to explore new horizons. So that came with the concept of forum theatre. Now, this is one of the newer things on medication safety which we have tried. Actually, forum theatre, the concept itself is a very old one. In 1960s, a person called Augusto Boal, a theatrist, did this forum theatre. So it's a new theatre art which is similar to our Vidinatya Kalava. We know Vidinatya. So what happens is that they did performances among the poor and oppressed communities, emphasizing the social injustice. So then the spectators, the audiences, will come to the stage and act and show how to correct those social injustices. So this new term, spect actors, came with this forum theatre, and this is Augusto Boal, a theatrist, and his company, the theatre company, the Theatre de Arena de Sao Paulo. They traveled to some of the poorest places in Brazil, staging all these dramas. So, so if you go to the Wikipedia, you can see forum theatre. So what they say is that forum theatre is a theatre of the oppressed, provides a process for testing actions, which can transform the groups, communities, and social systems in which we work and live. It is a rehearsal for change. So see the words testing actions and rehearsal for change. So we thought whether we can use this same thing for medication error teaching. So what we did, we formed a group of actors again, and then we found the latest medication errors which occurred in the recent few months, and we trained those staff to to play all these scenarios in the real setting. And then we got this healthcare staff from all the categories, doctors, nurses, midwives, pharmacists, and attendants in a workshop. Actually, we tested this in Kadugana MOH area with oil MOH staff involved. And our prepared staff enacted these real-world setting scenarios in front of the audience. And at the end of each scenario, we asked the audience, so what are the kind of holes, to identify the holes and suggest remedies. And we asked them to come and replace the actors. So they will be replacing the actor one by one, and we will be playing the scenario again to see whether we can get the error-free outcome. So until we get the error-free outcome, the scenarios run in 2 or 3 times. So with that, they got a kind of collective idea how the things can go wrong, as well as how the thing can be corrected, and how easily and as well as how difficult it is to correct, even with one person's action or 2 person's action. So it was quite well, it's a kind of immersive experience that they got. So I have the Forum Theatre a small video to show you, if you can play. Yes? So we'll go through, it's a kind of a coalesced video which we did with the action. So this is the action by the facilitating actors. So they were playing the drama. So the errors, they were trying to correct the error with the spect actor. The doctor came and replaced the actors. So this is a nurse coming to replace the acting nurse. Play. So it's the end actually. So we were giving the certificates, and this facilitating actors. So they were quite talented, and there's a few of the staff involved in the process. So yes. So sorry. So, so at the end of the process, we wanted to know the participants' perception. Actually, this is a new thing we tried, so never tried before. So, so we asked for the participants' perception, and we got that participants unanimously agreed on the efficacy of Forum Theatre, recognizing its potential to convey error prevention messages effectively, and over 94% believed it helps understanding medication errors and support error prevention strategies. Now, we asked whether can it be implemented in your own institution? That is the question actually comes. But of course, more than 2/3 agreed that they can use it. They can do it in their own institution. Now, I know the question in your minds now coming, where's the time for this type of things, and who are the staff who's going to act? Now, we put that same question to themselves, and the answers came from themselves. And what they say is that they can actually form groups of medication error prevention forum theatre interest group, and then they can make a kind of a group of actors. And what we actually need is some time from our clinical governance meeting, so that you can play and you can see how the things can occur and how the things can be corrected in a non-judgmental way, right? So it's kind of a very immersive experience for everybody, and it is quite easy to go through. So so as it says, the limitation, the time constraint, and staff limitation. So those are the things we can go forward and see. So, so this is the team actually behind all this work since 2016 with me in our department. So everybody's hard work, so extended hours of work, everything led to all these successful outcomes throughout in my simulation experience. To sum up, so we need to give more emphasis on teaching and practical aspects of pharmacology. And so we need to think about some innovative teaching methods to explore new horizons. So I think that will give us more kind of newer ways of thinking, as well as some insights for the, yes. Thank you.
Thank you, Tilanka, for that bringing up that novel experience to us. With that, we are going to move on to the final talk for today. This talk is going to be on optimizing medication safety through pharmacist capacity and capability building. This is going to be a recorded lecture delivered by Ms. Victoria Rutter. Victoria was appointed as the first CEO of the Commonwealth Pharmacists Association in 2016. Her dedication has significantly increased the charity's footprint and work streams, supporting better access to and use of medicine in lower resource settings, including pioneering the highly commended Commonwealth Partnership in Antimicrobial Stewardship Program. She has led advocacy as the civil society representative on the Commonwealth Advisory Committee on Health. Prior to this, Victoria led both service and workforce development through international collaborations in flagship hospitals in London and Singapore, developing an extensive global practice portfolio. Now we will listen to Victoria's talk.
Ladies, gentlemen, and distinguished guests, good afternoon from London. My name is Victoria Rutter, and I am the CEO of the Commonwealth Pharmacists Association. I'm joined today by my colleague Beth Ward, who is the Strategic Lead for Workforce Capability Building at the CPA. I'd like to thank the conference organisers for the opportunity to deliver this presentation, which focuses on building the capacity and capability of pharmacists to enhance the safe and effective use of medicines. My apologies that we were not able to be with you in person today. Representing the CPA today, we will attempt to bring a global perspective to the discussions. The CPA is a registered charity and an umbrella professional body for national pharmacy associations around the Commonwealth. We represent over 1 million pharmacists across every continent. Established in 1969, our mission is to empower pharmacists to improve health and well-being throughout the Commonwealth by leveraging expertise and experience across member states to support the development of the pharmacy profession and improve the safe and effective use of medicines. To begin our presentation, I'd like to put front and centre 3 things that I think we will agree on. Medicines are vital for the prevention, diagnosis and treatment of disease. Secondly, access to safe and effective medicines are fundamental to achieving universal health coverage. Thirdly, demand for medicines are increasing parallel to an ageing global population, translating to increased risks and costs, with spending on medicines being only second to the health workforce. If we agree on all of the above, it follows that effective and efficient management of medicines is essential to maximise outcomes, reduce risks and minimise costs. I'm sure you are all very familiar with these documents around medication without harm. I would like to focus us on 3 key action areas that were highlighted in the policy brief: high-risk situations, polypharmacy and transitions of care. All of these areas are areas where there is a growing body of evidence that appropriately trained and placed pharmacists can significantly reduce the risks to patients. In fact, by investing in appropriately trained pharmacists, not only can harm to patients be reduced through ensuring safe and effective use of medicines, but pharmacists can also help achieve health targets and reduce associated costs, translating to an increase in value for money, both for patients and the healthcare system. At a global level, pharmacists are often the most underutilised profession out of all of the multidisciplinary team. How we leverage their skill set and the roles we create for them is an essential component of the risk reduction they can achieve. This is quite old data from 2008, but it still helps to illustrate the point that appropriately trained pharmacists have a clear added value in terms of reducing medication-related risk and mortality when practicing in clinical patient-facing roles, which is over and above the risk reduction they can achieve in their traditional supply role. Many other studies have since also supported this trend, including work conducted in Sri Lanka. To free pharmacists up to deliver in clinical roles, it is essential that we also have a trained technician workforce to support them. We all know the urgency of the global health and care workforce shortage and the predicted 18 million shortfall in health workers by 2030. Low and middle income countries are disproportionately affected by such shortages, and as we can see from the map, this includes Sri Lanka. It is therefore imperative to maximise the use of the full multidisciplinary team. This further emphasises the massive opportunity to capitalise on the skills and experience of your pharmacists. Before I hand over to my colleague, I want to leave you with this slide, my second passion after pharmacy, of course, and I hope I have found some fellow cricket fans in the audience to appreciate this with me. Just like in the world of cricket, to achieve the best results, the unique skill set and expertise of each member of the team needs to be recognised and leveraged. So when we direct medicines at patients, we catch the risks and achieve the best outcomes. I will now hand over to Beth to discuss in more detail the capability and capacity building elements required for a fit-for-purpose pharmacy workforce. Thank you.
Thanks very much, Vicky. So developing an in-depth understanding of medicines and their safe and effective use is absolutely fundamental to the undergraduate training of pharmacists across the globe. With pharmacy being the third largest healthcare profession and one of the most accessible professions to communities, ensuring their ongoing development post-registration to maintain and build confidence and competence is key to delivering any medication safety agenda. Now, in terms of pharmacist development, historically what you'll see across the globe is that a student will complete an accredited degree program at a recognised university, and then this is followed by a period of supervised practice in the workplace, and then pharmacists would enter the workforce as autonomous practitioners. Beyond that, any development and advancement would generally be down to local opportunities driven by individuals themselves or by workplaces and employers. However, what we're moving to is having a requirement to complete CPD in order to maintain registration and establishing a career roadmap whereby there are structured training pathways aligned to globally agreed frameworks and standards for pharmacy practice to develop and advance the workforce consistently, building capability and scope of practice in order to drive greater improvements in the safe and effective use of medicines. Now, as you can see here, this is starting to look a lot more like a medical training pathway, where there's far more consistent approach already to development and advancement for the benefit of patient safety and the delivery of excellence in healthcare. Now, different countries are at different stages of implementation of this vision. Ghana has established the Ghana College of Pharmacists, which promotes continuing professional development, and it has also developed and has implemented specialist training pathways for pharmacists post-registration. Australia has established post-registration foundation level and advanced level residency training pathways for hospital pharmacists. And in the UK, there is now structured training in place for early careers pharmacists working in all patient-facing roles. So that's pharmacists working in hospital, in community pharmacy, and also pharmacists working in general practice. There are now also national standardised assessment of pharmacist practice at advanced and consultant level. And these national assessments, delivered by the pharmacist professional leadership body, the Royal Pharmaceutical Society, are designed to provide assurance of safe and effective pharmacy practice. So when we talk about structured training pathways being underpinned by globally agreed pharmacy practice standards, what we're talking about are these frameworks here that have been published by the International Pharmaceutical Federation. And these have been developed in collaboration with colleagues from across all corners of the globe. These competencies and capabilities are focused on building on the medicines expertise that have been developed throughout the undergraduate years. And they aim to support development and advancement so that pharmacists can manage patients with increasingly complex pharmaceutical needs safely and effectively. Now, the framework shown here is aimed at post-registration pharmacists in their early careers, but there is a similar framework that underpins training and development to advanced and consultant level of pharmacist practice as well. So when we think about what the most effective models of training are, once again, we've looked towards the evidence base for medical education to see how this fits in the context of service needs and the medicine safety needs within a country. Now, I think we can all agree that the most effective training models are ones that result in a workforce that is patient-focused and fit for purpose. And to achieve this, structured workplace-based learning is absolutely key. There are just so many benefits. Not only does it reduce service disruption, as clinicians are not being removed from service and sent away to a classroom setting, maybe within country, but often abroad and at great expense. But it also creates the opportunity for interprofessional learning and assessment, facilitating mutual understanding of the skills and capabilities of the wider MDT. There's a fast-growing body of published literature globally that demonstrates the positive impact of implementing this model of training at both undergraduate and postgraduate levels in terms of reduced harm from medicines, improved patient outcomes, and significant cost savings. A number of papers are coming out based on the experience of implementing this model in Sri Lanka. So one of CPA's collaborator organisations is CASPA, the collaboration of Australian and Sri Lankan pharmacists for practice, education and research. CASPA's founding director is Professor Ian Coombs, who is a global leader in pharmacy workforce development and medication safety. And you've actually already heard from Professor Coombs today. Now, the CASPA team has been working with colleagues in Sri Lanka since 2009 to embed clinical pharmacy education and training into Sri Lankan B-Pharm programs at 2 universities. The team have also been working with Sri Lankan pharmacy academics and B-Pharm graduates to deliver the novel Train the Trainer program, which further builds clinical pharmaceutical care skills and a workforce of clinical supervisors of the future within Sri Lanka. They've published evidence of the impact of this work through observational studies and also a key control intervention study comparing clinical pharmacy services with usual care in over 700 patients across a number of clinical areas. Here, they demonstrated significant improvement in outcomes in terms of appropriate use of and adherence to medicines, reduced unplanned readmissions, and reductions in HbA1c. Now, this paper here on the screen was actually published in a World Health Organization bulletin in 2018 as an exemplar of good practice. Not only did it demonstrate significant improvement in patient outcomes, but in economic terms, it demonstrated an almost 7-to-1 return on investment. And this is looking only in terms of the cost of bed days saved due to the reduction in drug-related hospital readmissions. So the CASPA Train the Trainer program embodies all of the key elements of effective workplace-based training and is aligned to global pharmacy practice standards. It's been taken up by a number of hospitals within Sri Lanka, so you may be familiar with this program already. So based on published evidence, I think we can see that developing a fit-for-purpose clinical pharmacist workforce will result in the safe and effective use of medicines, improved patient outcomes. It will help to optimise the skill mix across the MDT, and it will result in the cost-effective delivery of care. And based on evidence globally, to ensure that this is achieved effectively and sustainably, what we see is that health systems require profession-led pharmacy regulation. They require structured education and training and governance processes. There needs to be a sustainable supply of workplace supervisors to provide feedback on practice. And this can be achieved not only through upskilling pharmacists to become supervisors, but also through collaborative MDT working. They require standardised assessment to ensure consistency of approach. And we need a culture of lifelong learning within the profession with CPD linked to ongoing registration. Now, before I finish, I think it's really important to point out that when CPA attend Commonwealth ministerial meetings, Sri Lanka is always used as a shining example of how low-middle income countries can obtain excellence in medical care. With a vision that is shared by clinicians across professions, underpinned by evidence and global standards, similar excellence for pharmaceutical care with safe and effective use of medicines by all is just around the corner. Thank you.
As we are behind the schedule, we would like to conclude the session with handing out the certificate of appreciation to the speakers. I invite Professor Chamila to give the certificates to the speakers. Priyadashini Galappathy. Professor Pradeepa Jayawardena. Dr. Udpali Mannam Peruma. Professor Tamara Amarasekara, Dr. Thilanga Senivaratna. Thank you, Professor Chamila.
Thank you for that remarkable session. Ladies and gentlemen, as we come to the end of a successful conference, we have now reached one of the most anticipated parts of our conference, the award and closing ceremony. This is a moment to celebrate the outstanding contributions and achievements of our participants. We're grateful for the dedication and hard work for everyone involved. I would like to invite Professor Priyanka Ranasinghe, Secretary of SLACPT, to present the awards.
Thank you very much. There are several awards to be handed out at this time. I hope I don't mix them up. First of all, the awards for the poster competition. Just to explain a little bit of background about this, in conjunction with the World Smart Medication Day, an international poster competition is organized by IUFA. And the IUFA member countries have their own national poster competitions where undergraduates in medicine and allied health sciences submit posters along the themes for that particular year. And then 2 winners are selected at national level and they are submitted for the international competition. So likewise, this year also in 2024, we had the national poster competition in and around April, and then subsequently the national winners, there were 2 posters that were selected and they were nominated for the international competition. I'm happy to say both the posters nominated by Sri Lanka got selected for the 10 best posters, out of which one of our students became the winner of the international poster competition. So we are going to announce the awards at this time. First of all, to give away the winners of the national poster competition, I would like to invite Professor Priyadarshini Galappathy, President SLACPT. The national second place award of the poster competition goes to Bhagya Madhushani Bandara from the Faculty of Allied Health Sciences, University of Sri Jayawardhanapura. The national first place winners, ladies and gentlemen, is Ms. Vanessa Andrea Nugara from Faculty of Medicine, University of Colombo. Thank you very much, madam. Now I would like to invite Dr. Lauren Walker, representing IUFA, to give away the winners of the international poster competition. So as I said, these 2 students were nominated for the international poster competition. Of the 2 nominated, both got selected for the first 10 best posters. First of all, I would like to invite Bhagya Madhushani Bandara to receive her award for getting nominated for the top 10 best international posters from the University of Sri Jayawardhanapura. And ladies and gentlemen, I think this is a very outstanding achievement. I'm happy to say that our student was able to win the international poster competition. So please give a big round of applause to Vanessa Andrea Nugara for winning the international student poster competition from Faculty of Medicine, University of Colombo. Thank you very much, Laura. Next, we move on to the Intermedical Faculty Pharmacology Quiz Awards. Again, a little bit of background. This year, the SLACPT organized a pharmacology quiz for all the medical faculties in Sri Lanka. From each faculty, a team was nominated and a quiz was conducted. And subsequently, of course, all the 11 faculties participated in this. And today we are going to give the awards to the top 3 universities and the teams that are here. So to give away these awards, I would like to invite Professor Chamila Methananda and Professor Priyadarshini Galappathy. Yes, and Tamila was the quiz master. Sorry, I forgot to mention that. So the third place in the pharmacology quiz goes to University of Colombo. I will read out the names of the students, and I would like to invite Chamila to give away the certificates. Netmini Ratnayaka, Rosali Ratnayaka, Keetana Muhuntan, Chamod Pereira, and S. Atukorala. The second place goes to Faculty of Medicine and Allied Health Sciences, Rajarata University of Sri Lanka. I would like to invite the students to come and receive their certificates. Prishal Morapitia, Shehan Taruka, Ishara Samaratunga, Ishara Samaratunga, sorry. Dilshan Chatintaka, and Sanduni Nimesha. And now we move on to the winners of the inaugural pharmacology quiz organized by the SLACPT. The winners are Faculty of Medical Sciences, University of Sri Jayawardhanapura. I would like to invite the students to receive the certificates and the awards. Osura Veeravardhana, Viduni Suraveera, Praveen Fernando, Tarushi Liyanage, and Hasini Chandrapala. I would like to invite the entire team to come up here to receive the cup for the first place at the Inter-Medical Faculty Quiz Competition. Ladies and gentlemen, University of Sri Jayawardhanapura, Faculty of Medical Sciences. Thank you very much, Shamila and Madam. Now we move on to the last group of awards to be given out today. These are the awards given for the research presentations. First of all, I would like to invite Professor Priyadarshini Galappathy, President of SLACP, to hand over these awards. First of all, the poster presentations. The third place in the poster presentations goes to the presentation titled Development of Indicators to Monitor the Safe Use of Medicines by Patients in Sri Lanka, presented by Indunil Velivatta. I'd like to invite Indunil Velivatta to receive her certificate. The second place goes to the poster titled Antibacterial Consumption in a Private Hospital in Jaffna, Sri Lanka, presented by Haridas CS. And the first place goes to the poster titled Pharmacogenomic Variants Affecting Safety and Efficacy of Antimicrobial Drugs in a South Asian Population from Sri Lanka, presented by Jayaprakasam H. Now we move on to the oral presentations. The third place goes to the presentation titled Artificial Intelligence Assisted Automated Essay Scoring Tool to Evaluate Short Answer Questions in Pharmacology, presented by Seneviratta HMTW. The second place goes to the presentation titled Frequency of Pharmacogenomic Variants Affecting Efficacy and Safety of Anti-Cancer Drugs Among Sri Lankans, presented by Manchanayaka MM. And the first place goes to the presentation titled Association between development of atrioventricular blocks and reverse tick sign of digoxin effect in acute yellow oleander poisoning patients, presented by Ariyaval. Thank you very much, Madam, and congratulations to all the winners. So, ladies and gentlemen, that brings us to the end of two very fruitful days of discussion centered around medication safety and the use of medications without harm. I hope we have not given you an overdose of pharmacology. I would like to thank all the speakers, both local and international, who joined with us during these 2 days and shared their experiences and vast knowledge with all of us here. I would like to thank Professor Priyadarshini Galappathy, President SLA CPT, for the excellent leadership in getting all of this together. And I hope there are a lot of participants here from different sections, not only doctors, pharmacists and nurses. I hope what you have learned during these sessions you take back to wherever your workplace and start implementing these things to ensure that patient safety is guaranteed. And let us continue this dialogue and discussion. Please do engage with us in the future as well. Thank you very much, and I hope you have a pleasant day. Thank you.
Thank you, sir, for those remarkable closing remarks. Ladies and gentlemen, as we come to the end of a successful conference, we have now reached, I'm sorry about that.